Okay, I'm reading. All right, so now I'm going to read this script. Bear with me with this formality. Um, Thank you for joining the City of Kingston's Live Well Kingston Commission meeting. Today is June 17th, and my name is Emma Flynn. I'm the Director of Health and Wellness for the City of Kingston, and I'm going to be the organizer for the Live Well Kingston virtual meeting. Before we begin, we'd like to go over a few meeting guidelines to help us navigate the system. We ask that the members of the public and press remain muted for the length of the meeting. As organizer, I reserve the right to mute anyone who unmutes themselves. We're less formal than the commission who this was written for, so we do have more conversation, but that is kind of our policy. Commission members and city staff will control their own mute button. Good practice would be to mute yourself if you're not speaking to avoid background noise and feedback. If participants wish to speak, they will raise their hands. The chairperson will call on them before they speak by saying their name clearly for our audio listeners. All of our meetings are recorded. Both video and written transcriptions will be made available to the public on the city's website at a later date. Although we have not, do not have public speaking tonight, you can submit written comments. I'm going to tweak this a little bit for Live Well Kingston. I'm going to ask that in our announcements and communications section of our agenda tonight, if you'd like to talk with us tonight, that would be a great place for it. If you have any audio issues, you can try to text me at my cell phone number. I'm not going to be able to take any phone calls this time, and I am going to be trying to balance a lot of things here, so I may not be able to provide great service. But if you have audio issues, you can text me at 914-646-0763. Let's see, as the organizer for today's meeting, I reserve the right to lock and pause the meeting to eject anyone who has behaved inappropriately. Let's see, lastly, at tonight's meeting, we have, so I'm going to be leading the meeting. I'm a City of Kingston employee, but I'm not the chair of this commission. The chair is Jerry. He's not here today. Then we have other commissioners. Let's see, I see Anna, who's a commissioner. I see Lori, who's a commissioner. Melinda's on the phone, who is a commissioner. Let's see. I think Stacy is a commissioner, if I didn't say you, Stacy. And I'm not, and see, and I think Doug is one of the callers, and I'm not sure who the other caller is right now. But those are my commissioners, and I don't see any other city staff with us tonight. So, and I guess I'm going to call this meeting to order now at 4:13, and I'm going to try to make a note of that as we go. But my technology is moving slow. So, I guess now I want to just try to make sure we know who everyone else is here. Is there someone else who's on the phone other than Doug that would like to introduce themselves? All right, hearing none, I think I'm going to move on. All right. Hey, is someone talking? All right, I'm going to move on then. The agenda for this meeting has been on the City of Kingston website. In case people cannot access that information while we go along, I'll just mention now quickly what our agenda is. I call this to order. First up, we're going to do our reports from Eat Well. We're going to try to I changed this on the agenda a little bit so that Katie could go quickly before she has to jump off. Then if we have enough commissioners for a quorum, we're going to do approval of minutes. Then we're going to do some administrative matter about an open seat. Then we can hopefully touch on old business, which is a previous conversation about community agreements. And then in new business, we can have a conversation about a potential Grow Well focus team and an undoing racism training. Then we'll have announcements and communications, and I can mention our focus team dates that are coming up. Any questions around the agenda right now? All right. Then let's see here. We don't have our secretary here, so I'm going to try to take some rough notes. So why don't we jump into reports? Katie, do you want to speak to what Eat Well has kind of picked up or been working on, and anything that is kind of follow-up questions or clarifications I can try to answer, so you can jump off if you'd like.
Okay, sure. Hi, everyone. So Eat Well, we meet every other month. So we met in, I want to say, beginning of April and the beginning of June on Zoom. We had probably like 15, 20 people each time from different agencies. And I have a document that we kind of summarize some of the different changes and the different agencies are working on because of COVID-19. So things that have changed, like the way my work. It's a full page, so I'm not going to go through it in great detail, but I will share that with everyone later. But to say, a lot of things have changed, including the Eat Well back in February, having presentations and doing tours of the farm hub for the meeting, see the fields, and that did not happen. So for the next meeting in August, we may try to have some kind of presentation. We did have Maria Reidelbach present in April on the Turning the Tables cookbook, which is the writing in cooperation with Cooperative Extension. So she did a little presentation, and there's been just a lot of networking and talking about the work we're doing. I will also mention Kingston Emergency Food Collaborative. A lot of those members are also members of Eat Well Kingston, and that whole effort really kind of grew out of some conversations that started right in the beginning among a couple of members. And I think we don't need to do in-depth updates on the Emergency Food Collaborative unless anyone wants, but that kind of grew out of it, and we're discussing like how that collaborative is going to live in relation to Eat Well and all the other efforts that are going on. So the other thing I will just add, which kind of pops out at me as I look at this list, is that food insecurity has gone up. Just we know that anecdotally, but also the coordinator was at our meeting earlier in June, and she didn't have hard numbers, but she said that applications for the SNAP program have increased a lot. And also, unfortunately, they are cutting their each position. So the county is going to be losing the person that does around the county. So yeah, those are the updates. We're trying to figure out how we're going to move forward.
Thank you, Kate. Any questions about the Eat Well report? I do want to mention a little bit about the Kingston Emergency Food Collaborative response, because we haven't talked about that here in this group. Okay. Yeah, just a little bit. And Katie, if you jump off, feel free. I just want to mention that at its height, the Kingston Emergency Food Collaborative was delivering around 3,000 meals a day. That's at its height. It scaled up quickly from around 300 meals to 3,000. Grocery delivery is still happening with a partnership for People's Place, and a limited meal delivery is still happening out of the Everett Hodge Community Center. As Katie mentioned, we're having conversations about how to work on food security going forward, and I'm very optimistic and excited about those conversations. Any questions from anyone around the Eat Well report or food security issues in Kingston at this time? All right. And feel free if I find this internet connection is not very strong right now, so I'm feeling disjointed with me. But I do want to say, if people do have questions, they could put it into the chat box. You can always reach me later we can try to answer those questions. All right, I'm gonna move us on then. We do not have a quorum, it looks like, with commissioners, so I do not believe that we'll be able to do the approval of the minutes right now. And we probably won't be able to do the administrative matters, but I guess I do want to just welcome Shai, who has expressed interest in being a commissioner. I've sent the other commissioners her application. I'm sorry, Shai, you used she, her pronouns. Is that accurate? I'm sorry to assume.
Yes, I do. Thank you.
Thank you, Shai. Usually at this time, we invite those people that have applied to be a commissioner to introduce themselves to the commission. This is a little bit different since we're doing this virtually. Usually we're in a conference room and it's a little bit friendlier. You know, we can see each other. At this time, would you like to say anything or introduce yourself in any way?
I'll start. My name is Doug Coop. I'm a Ward 2 Alderman, and I'm the council liaison.
Sure.
To Live Well.
Hello, everyone. My name is
Sorry for the confusion. Thank you, Doug, for introducing yourself. I meant for Shai, who's applying to be a commissioner.
Oh, okay. Okay.
Shai, would you like to go on? Hello, everyone. My name is Shahidra Ward King. I go by Shai, and basically I work in the community.
Yeah, are you still there, Shai? I'm not. I can't. It blinked out on me. Did it blink out on other people?
Yes.
This technology does not seem to be working right now.
Can you guys hear me?
Oh, now I can.
Now I can. Yep.
Is it working now? Shall I try to continue? Is the connection really for everyone, or is it just me right now?
Okay. So I've basically been working in the community for 3
Oh gosh.
for family health.
Shai, we're having trouble hearing you. Let's see. Anna, since I can still see you, how's the connection for you? Is everything jerky for you?
Yes, everything is jerky for me. Yep. I get bits and pieces.
Yeah. And when I talk as well?
I could hear you fine.
Oh, okay. All right. Thank you, everyone.
And I heard Katie. I heard Katie fine too. So.
Okay. I'm considering if we should try to remedy this situation with technology or just forge ahead and have it be not a great communication right now. Not sure what else to do. I could start us up again. Would other people be interested in trying this with Zoom instead of GoToMeeting? It might be a better connection. I have better chances with that, but it might take a lot of work to try to get everyone to show back up on another connection. So we forge ahead or try something different?
I say forge ahead.
Okay. Thank you. So Shai, sorry about that. Sorry we weren't able to hear you. Why don't I try to email you and maybe you can try to send me like a paragraph about yourself, and I'll send that out to the commission so that they have kind of an introduction. And since we don't have a quorum, we won't be able to vote on you becoming a commission member anyway today. So that'll give them a chance to get to know you. and then maybe the next meeting we can put out a motion for a new commissioner. My apologies on this connection. Our next topic on our agenda was the community agreements, which was something that the commission had discussed in the past. I had hoped to have a good connection to try to bring that up on screen to show everyone. I could try to now. We'll see how the technology goes. I could try to share my screen. See, it's moving slow here. I'm not sure if this is going to work. We'll try it. Let's see, can you, is anyone able to see my screen at this time?
Yes.
Great.
Yes, I could see your screen.
All right. Success. Thank you, Anna.
I don't know if I could read it.
Yeah. All right. Let me see if I can.
Yeah, it is small.
Is it small? Right.
I'm so sorry about that. This is Shai speaking again. I lost connection, but I'm back. Thank you.
Oh, I'm so glad to have you back. Do you want to try again?
Can you hear me? Can you guys hear me
Yes.
now?
Yes,
Okay.
I could hear you now.
I had to move my location. Sorry about that. My name is Shai Ward King, and I go by Shai. I've been working in the community for 3 years as a case manager at the Institute for Family Health. I also own a holistic business that's been operating since 2017, but recently just opened here in Kingston. I'm going to actually turn it clinical because I'm in school right now to be an expressive art therapist. So that's pretty much it. We have 2 teenage girls, 12 and 14, so pray for me. And I enjoy anything that has to do with wellness. I live, eat, sleep, and I really think that it's important specifically for at-risk communities and people of color to be connected to spirituality and wellness to some point of time. So hello, and thank you for allowing me.
Our pleasure. Thank you so much for and following up and making you try to come to. So thank you so much. I've got a little bit of an introduction. Shai. I'm going to move us. I'm going to try to share my screen again. So, oh, technology, you're not my friend at this moment. Oh, there we go. Okay, it's coming up. It's just moving really slowly. All right, someone give a yell when you can see my screen.
Yay, I
All
can
right.
see your screen.
So I'm not gonna. All right, let me give a little bit of an introduction to our commission. I went to a great conference last year called NISA, which was Northeast Agricultural Working Group, and they had community agreements like this. And I brought this back to our commission, and I was trying to propose this as a way to create a culture of inclusion for the commission and for all. And the idea was that if the commission could kind of approve these tenets, that we could then use them as tools to bring to our focus teams. We've had a few discussions around this, and we don't have enough commission members to vote on it again today. So I'm just gonna, I think, bring it up, maybe just read through a few of them, and if we would like to have some discussion around it today, we can. Otherwise, maybe we'll table it until we have a quorum. So the agreements that I had proposed and that we'd worked a little bit already is to be curious, open, and respectful, that no one knows everything. Together we know a lot. We can't be articulate all the time. We take care of ourselves, that we have confidentiality. We speak for ourselves, not for others. We have one mic, that there's one voice at a time. Technology in some ways makes this more official. It feels like it's hard to have multiple people talking at once. Take space, make space. That's really an invitation to people who, how do I say, don't talk a lot, to step up and take space. Please do in this conversation. Those who have a lot to say, to maybe take a pause and step back. Avoid jargons, acronyms, and industry language. I find this often a lot with my work. People assume that everyone knows what an acronym is. I'm trying hard to not do that. Be aware of time. I think that's pretty self-explanatory. Speak from your own experience. Use I statements rather than generalizations. And be conscious of intent versus impact. This was the one that was the stickiest the most with our commission in the past. We edited the language to read, no matter your intention, be aware that your behavior has an impact. And then we added, and vice versa. The last one is avoid using isms without explaining what you mean by them. Any questions around what community agreements are, or the role of them, or discussion about any of these points? Any thoughts on this at this time? All right, we're kind of a quiet group tonight. That might be technology. So if someone has a thought on that, feel free to. So I'm just glad that we're kind of bringing this up now, and we can remember that this is on our agenda to talk about in the future, and bring it up again next time we have a quorum. Okay. So without any other voices, anyone again, feel free to. I wanted to bring conversations around a new focus team. I'm not going to put you on the spot quite yet, Sarah, but if you'd like to in a few moments join the conversation, please do. I was going to just start by mentioning a little bit about how this came to be. My understanding is that part of the mutual aid group in Kingston started having conversations about agriculture in the city of Kingston, and they kind of formed and have started doing some projects. And conversations went around, like, should this be a focus team for Live Well? Sarah, would you like to express more about the group?
Sure, yeah. So, hi everyone, my name is Sarah. I work at the farm. And a group, and our first project called the Garden Bed Project, Kingston Garden Bed Project. And what we're doing is we're working with the Kingston YMCA 20 in Kingston residents who apply bed, and we're trying to focus in through an post. One way that we've hopefully reach those folks is by wearing at the emergency food distribution to receive emergency food. And yeah, I guess I'll just say more broadly that so over the summer we'll do 20 garden beds for us to work together. but I think more broadly, you know, we're a group of different organizations in the area around farming, and and the group together. But I think it a separate grow well part of Live Kingston seems for most people. Yeah, I guess we'll see how that goes as the group progresses. It's all really over the last month, maybe more, sort of understand how we work together and, you know, have something really tangible that will have a small impact, but could potentially grow into something bigger.
And I wanted to bring up that some of the people who were interested in discussion about it becoming had some specific questions for the commission. And I can get, I don't know if I'll get them around how much control would the commission the decision projects that they decided to do. I have expressed that in my experience that has been on projects. But the commission hasn't ever if I guess if the
Hello?
Go. I think someone is targeting very people, people of color, indigenous. They have a whole list of the people that they're targeting, and their concern was, would the commission ever have an issue with that? I don't know that I expressed it very well, but I tried to, or say better this time. I think that is to address the qualities, and I think that that's a tenet of what we're trying to achieve. I really hope that Live will kind of support that kind of. Would you like to talk?
Emily, a couple of words. Sorry.
And here, let's see. Maybe I don't know. Does anyone have any questions about Grow Well at this time? Otherwise, maybe we'll keep it on our agenda, and our next Live Well Kingston meeting, I'll try to host from City Hall. Laura, you got it?
Yes, I was wondering, are these raised gardens only for people's home?
Yeah.
I live in gardens, and I've been talking community garden here. So would a development be eligible? Like development?
Well, we actually had talked a lot about the idea of installing multiple garden beds, like at an apartment. We'd be able to have multiple people who could potentially work together, even if it's just getting garden advice. So I would definitely encourage you and your neighbors to mention in the application that you have, you know, you're interested in starting more of a community effort. I would also say that the Kingston Land Trust could be a really good resource for you, because they work with community gardens and potentially might help you get started. So I'm happy to follow up with you. I could put in the chat the link to the application so you have it. It's like an online Google form. And if you have any questions, I'll put my email as well.
Thank you. I would appreciate that.
Okay.
And yeah, so all the information for the application will be on our website.
I will just send you in the chat. I'll just put the link, and all of the information about the program is in the application itself. You can just click on that link and read about it and fill it out yourself.
Okay.
So Emily,
Yes,
I just had one. And actually, I think the focus team idea is really great. But going back to how will Kingston emerge with the set of focus teams that were on the list to be filled out, there was one called Grow Up Well, and that was really for children. It's sort of for people that are working with kids as they grow up. And I'm just want to be cognizant that that framework was there for Grow Well, and whether garden well or, we'll have Grow Well and Grow Up Well, it's just something to think about.
Thank you for that, Melinda. I did recognize that at one of the meetings with the agriculture group. My thought around that, and this is a discussion, was that there's some real energy right now around this Grow Well group. I guess I kind of thought that maybe the name could go to them, and then if there's more energy around support, we could come up with a new name for them. But that was just my thought about that. And Stacy is posting that she doesn't think we should get.
I don't have strong thoughts one way or the other. I just.
You broke up a little bit there, but I did hear you say you didn't have strong.
Sorry, I have a lag here, right? Some thoughts about it. I just wanted to be sure everyone was aware of it. That was the original framework.
Thank you, Linda. And Stacey's really choppy on her end. I think it might be on all of our ends. It might be that, so the way that I'm using this right now is I'm going through the city's internet. It might be that my connection is just really bad and is making it bad for everyone. So unfortunately, I think that we're not going to be able to have a real robust conversation. So Stacey's kind of proposing that we should not go into deep conversation on this. We are out of time. So I think we kind of introduced it now, and I'm going to propose that we kind of what's it called? Move this meeting to the next time we get to talk. I see some head nods.
Okay. Yep.
So then I guess I just have a few other things to mention. This will be one of the shortest liberal meetings ever. I wanted to mention that through some of this work with Kingston Emergency Food Collaborative and the Urban Ag Group, there's been discussions around needing for training. This came up in the Kingston Emergency Food Collaborative as a conversation around conflict mitigation. There was a few conflicts that happened, and there was the need for training for volunteers. So we're still working on that. That's not a thing yet. And then in the Urban Ag Group, we talked a little bit about training the people who would be front-facing with the public to have cultural competency, anti-bias, and not undoing racism training. So around that work, I've done a little bit of research, and in my meeting notes, I'll send out a link to a document that I've created listing some of the training options that I'm collecting. I'm bringing that up here because I really hope that I might be able to do an undoing racism training here for our commission. That's why I'm bringing it up. It feels very timely. I think that it's something that Live Well as a commission has not. We have talked about inequity in health systems in Heal Well. We've touched upon it here in our commission, that I think that we need to dig deeper and do some more work on it. I have toyed around with the thought of trying to do a post on our social media or our website about being in solidarity with Black Lives Matter. But honestly, at this time, I feel that our commission has a lot more work to do before we can do that. So I have not. If the commissioners feel differently, please let me know. But so I am going to keep working on trying to find some training for us as a way, as a commission, to really start to dig into these topics. Any thoughts or questions about that?
Hi, it's Shy again. I would definitely be interested in talking to you a little bit further about that training. So.
Wonderful, Shy. Shall I email you offline?
Absolutely. Thank you.
Sounds great.
Hi, could you email me too also?
Sure. Is this Dr. Woodley?
Yes, it is.
Will do. Will do. Good to hear your voice.
Thanks.
All right.
Emily, I wouldn't mind being emailed as well.
I love this interest. Thank you, everyone. All right. Any other thoughts on that before we move on? All right. So
have you had any feedback on the impact of being quarantined on the city? Because if we look at some of the statistics that came out through Department of Health, substance abuse is up, and over the past month, the suicide rate was up compared to the last 2 years. So apparently there are some adverse effects. So is this something that we should look at?
Sure. Specifically for the city of Kingston, you're asking?
Yes.
Yeah. I've seen some of that data as well, and I think it is alarming. Do you have a thought or proposal about what you think Live Well Kingston's role should be?
I'm thinking that ties into the whole concept that you spoke about earlier, of dealing with trauma. So I'm thinking that as we do that, we should tie in some of this, because this is actually concrete evidence of what happens when things change, in quotation marks.
Absolutely. I mean, we knew that there was a lot of trauma in our community already, and I just have to assume that there's a lot of pain going on right now. I know that O Positive and some of those partners have created a hotline in our community where anyone can call and get free mental health services. I'll include that information in our meeting notes. I think that there's a great need in our community. I think that we're just seeing the start of it. I think in many of my food discussions right now, I'm hearing about how the impacts on food is going to be long term. We were just in a phone call with the Hudson Valley Food Bank, and he said that from the last recession, it took a decade, or people had not quite gone back up to the food security that they had seen from the recession. And I feel like that's going to be true for a lot of these different things. I think it's going to take a long time for people to quote unquote recover.
Yeah. Hey, Emily.
Yeah.
Emily, can you hear me? It's Susanna.
I can hear you.
Yeah, hi. I heard from I heard on WAMC the other day over the weekend. Pat Ryan was being interviewed, our county executive, and he was talking about turning the hotline that's been operating at the Department of Health into a kind of a one-stop shopping hotline for all kinds of issues, which was a great idea. So for food, people who are looking for food, people who are looking for mental health counseling, people who are having housing issues, that he was talking about the same thing. This is sort of just the beginning of really understanding and beginning to address longer term needs of the county. I know this is Liberal Kingston focusing on Kingston, but I don't know what his plan is or the county's plan is to staff that or to bring agencies together to start addressing some of the gaps in need. But I thought that was a great idea. Right now, there's so many different, right? There are several different mental health hotlines, and then there's, families doing something, and then the Institute's doing, and so to have one place where county residents can call and learn about different resources might be helpful.
Absolutely, Susanna. And, in that communication subcommittee that we've both been in for Integrated Ulster, we've talked about wanting, single points of information gathering, right? And I'm so happy to hear about that hotline. I've heard that as well. Other brainstorming or other thoughts about how we can respond to our community? When I emailed the commission, who's talking?
Oh, Emily, it's Vin. I just wanted to, if you want to finish, go ahead. I just wanted to comment on a program that we're setting up specifically for Kingston with respect to opioids. So I can do it now or wait till you're finished, whichever.
No, please do it now.
Many of you who attended our various opioid meetings know that we have identified a gap in terms of being able to not only provide people with immediate response to overdoses and harm reduction, which are relatively short-term interventions, but also to be able to follow people through the entire multi-year continuum of care and treatment and recovery, and to make sure that no one slips between the cracks and gets lost in the system. And so we developed this model and we called it a high-risk mitigation team, but essentially people can get referred to the team through a opioid court, jail discharge, direct reach out from the public through one of the hotlines, an opioid incident from referral from the police or fire departments in Kingston. So once they come to the team, care managers would sit down with that individual and kind of ascertain their needs, find out what their background is, so it's worked for them, what hasn't, put together a customized plan to recovery plan, and then that's adjusted over time, and then work with them along with peers who are really accountable. And so it's designed to be a very proactive, very accountable, very focused team that deals with people who are vulnerable and who have the most persistent who are at the highest risk of recurring overdoses. And so we decided that rather than trying to do a proof of concept for all of Ulster County, which is a bit unmanageable, and Ellenville's kind of working in some of those outer areas, that we would do it in Kingston, because it's geographically defined, it's small enough for us to have some real controls, because really we want to be able to because it is proof of concept, we want to be able to really focus in and really measure results and see if it's actually making a real difference. Very different from things that have been done in the past, where people have been connected to care or treatment or what have you, but nothing really that follows, no thread of continuity that follows that individual throughout the process. And so we are, we're well underway in the planning and development process, and we've applied for a couple of grants. We have some interim funding, and we may just start it really small and then expand it out from there.
Vin, is there a name for this program?
Well, we're calling it, for lack of a better term right now, we're calling it the high risk mitigation team.
Okay.
And it'd be collaboration between Sheriff's Sparkle team, Kingston Fire and Police, Department of Health and Mental Health, our peer organizations, our treatment providers. But the idea is people would come to this team, and wherever it is that they get referred out, the team will always be there with them and for them, and regardless, even if they go into an inpatient program and they get released, or they get into an outpatient program. The team is kind of like the personal connection, warm human being connection to those individuals, to really make sure to watch their backs and make sure that they don't slip.
Thank you for that update.
Emily,
yeah, go on.
Emily, Doug Coop, can I make a comment on this?
Sure.
With regard to is there a need for this? I understand from the sheriff that opioid use and drug overdoses are up substantially, like 50%, since the pandemic started. So I think, it sounds like there definitely is a need for this.
Thank you for that.
Also, Kingston has 40% of the overdoses in Ulster County, even though it's only 13% of the population. So it's a real hotspot, and
that's
even
an interesting statistic.
Yeah, COVID has really exacerbated. If you think of opioid use disorder as a chronic disease, the chronic disease that it is, we know that the COVID pandemic has exposed vulnerabilities with people with underlying chronic disease health conditions, and opioid use disorder is no different. It's just whatever challenges and difficulties existed before are now magnified by multitudes of factors.
Thank you for that information, Vin. That's great to hear that work is happening here in Kingston. Thank you for bringing that today. Any questions around the information around the high risk mitigation team? Dr. Woodley, does that kind of inform some of your question that you had earlier about our response to suicides and drug abuse happening because of COVID?
Yes, somewhat, but I think we should also because that is basically looking at what we are going to do about the persons who are using, and to try to prevent these incidents from happening. But I think that we also need to take a broader look at what other community supports are out there that could be put in place, even help some people who might be thinking about going down that road, to have them not go there. And it's actually good to hear that there are there's a mental health support line in place, because sometimes when people can't get professional help, they treat themselves, and opiates is one of the forms of treating yourself.
Yes, absolutely. Lori, go ahead.
Yeah, so I wanted to ask Dr. Woodley, is he talking on terms of the interventions and mitigation team? Uh, is he also talking about like a preventative type scenario to stop them from even going that direction?
Actually, both.
Okay, thank you.
Can I just add something as well?
Go ahead.
Hi, this is Shai again. Hi, Dr. Woodley. I don't know if you heard earlier, but I also work at the Institute as a care navigator for children and chronic illness as well. I just wanted to also add that this is a great example of why we need an initiative to talk about this cultural competencies. I believe that this is one of the biggest barriers in place toward people seeking mental health services. Is one of the reasons why these rates for opioid addiction and barriers to mental health services are created, and they are occurred right now. So, I mean, I think that Dr. Woodley brings up a great point, and I think that the bigger picture is that we have to break down these cultural barriers so that people who are at risk are able to seek out these services that are provided, even though the services in the county are limited, and there are services that are closing due to the COVID and the pandemic that can't sustain. But the larger picture is to have this discussion about cultural competencies.
Thank you for that. Yeah, I agree. I think there's a lot of discussions to be had. Any other would chime in? Thank you, everyone, for this discussion. I think that there's more to be had. I'm feeling inhibited by this technology right now, so I feel like I'm not conversation as I would. Future we'll meet in person, or the next time I host this meeting, I'll have a better internet connection, and you can hopefully dive in a little bit deeper. Anyone else like to contribute with any announcements or communications, or thinking of the topics around health that we should shine light on at this time? All right, I'm gonna focus teams, and then if someone in after that, there's another opportunity. So I did want to mention that we just had our Age Well focus team on the 16th. The next Urban Agricultural Working Group, which might be Grow Well, is on June 18th. They meet every week. And if anyone's interested in that group, I can send them meeting information. June 26th is our Very Well meeting. We met during COVID times, so that'll be an interesting conversation. Our next Heal meeting is July 3rd. We have met this month, and we had a conversation around responses during these COVID times. I'm going to collect team reports around some COVID and organizations and what how people have responded in this time, and I'm going to put it there. Maybe I'll try to add in the meeting minutes. I'll pass it in the meeting minutes. Then mention that Healthy Ulster will be on July 9th. The time Healthy Ulster was held is a virtual meeting, and you have to sign beforehand in order to get that link. Any questions around focus team meetings or other events, or any other comments at this time? All right, thank you everyone for being patient with the technology. Oh, Stacy, are you there?
Hi. Yeah. We were asking how discovered needs are complicated to get into now with the bed connections, but as people are doing their assessments, I think that we need to keep the lack of childcare as a real priority for our community. People are being called back to work in the reopening phases, and not all the previously available childcare options, including children's programming and camp, are opening. Some are opening only at a 50% capacity than they previously allowed. This has limited the availability for working parents. So what happens? Parents can't go back to work. In many cases, children are being put in jeopardy when they're left with slightly older siblings that may not be truly safe situations, or other arrangements that are not furthering the children's developmental needs. They're going to be left on screens all day. And we need to understand that in the pandemic, we're socially isolating, but this has such an impact on the informed situation that we're to discover about, how do we help kids to have a healthy childhood? Well, they need to be in situations that are safe. And I just want to keep this on people's radar. Thank you.
Yeah, thank you, Stacy. I hear what you're saying. I've seen examples of that. I've been in touch with the Everett Hodge Community Center a lot during this time, and they're trying to open up to support some of that childcare need. But something like half of the childcare opportunities are not available at this time. The city's Parks and Rec program that usually does childcare in summer at this time is not going forward, but I think they're trying to figure out how they might be able to in the future. I think childcare is a need. I agree. It was a big need before. Like many things, I think COVID has a light on a lot of the needs in our community. And at this time, again, thank you all for tonight. Thank you for being patient with this technology. Hopefully we'll have a better connection next time. It was lovely to see your faces for this short time and to hear your voices, and I hope you all stay well. Good night, everybody.
You too. Bye.
Bye. Thank you.
Good
Bye.
night. Thank you.
Good night. Bye. Thank you.
All right.
I'm trying.
Yeah.
I don't know how to leave this. Start out again.
Well, you just have to hang out with me more, Larry. I'm trying to figure out how to. Yeah.
The button. Okay.
Yeah. How to download the chat. It was good to see you, Larry.
Oh, okay. The red button. My granddaughter was correct. Okay. See you, Emily.
How do I download this chat? Maybe I don't. All right. I think I'm just going to end it.